Hi, everyone. My name is Sam Sheets. I am going to be a rising senior at St. Mary's College of Maryland, and I am a biology and psychology double major. I have been working with Dr. Lindsay Clendaniel, the owner and pediatric psychologist of Thinking Tree Psychology, um, on an internship this past summer, learning about different aspects of clinical psychology and assessment. And today I am pleased to be presenting with you my presentation on concussions. So first, I want to start off just talking generally about what a concussion is. Uh, it is referred to as a mild traumatic brain injury, or MTBI. I do want to express the fact that just because it is referred to as mild does not mean that it is mild in the way that most people consider the word to be used. It is still a brain injury, it's very serious, and it needs to be treated as such. So a concussion is a type of brain injury that results in the head, um, where the brain moves back and forth very quickly, sort of in a jolting motion. And this could be caused by one of two things. Either your head is hit and it causes your head to move back and forth, or your body is hit, which results in your head moving back and forth. So I want to go into a little bit about what actually goes on in your head when you have a concussion. So as I explained, when there is a concussion, your brain moves very, very quickly back and forth. And as a result, your brain cells, otherwise known as your neurons, tend to stretch. This is specifically located on the axon portion of the neuron. Now, if you look at the picture on the right side of the screen, on the first part of it, that is a neuron, and sort of the long skinny part is called the axon. This is the part of the neuron that really helps you transmit information throughout your brain. So when this part of the neuron stretches, it can have the tendency to either be severely damaged or it can even break in some instances. This can inhibit some of the information flow that goes on through your brain, which, as I'll explain a little bit later, can lead to some of the cognitive difficulties that are experienced in some concussion patients. And there's not a real way to detect where the neuron damage is going to happen in the brain. It can happen anywhere, which is the reason why these symptoms that you have can vary between people depending on different events and etc. So there's a few different warning signs that you can look for if you think that you might have had a concussion. One of the big ones is a headache. You might have difficulty with walking, especially if you've been hit in the head directly. You might have incoherent speech, meaning that your sentences might not appear to make any sense to other people. Your words might come out as gibberish. You may also have noise and light sensitivities, which could be impacted if you're using your phone or watching TV, for example. You might also have trouble concentrating, which could be very difficult in work or schooling situations. It can happen. You might have short-term memory deficits around the time that you were hit in the head. And another serious one is it's possible that you might have a loss of consciousness, otherwise known as blacking out during your blow. It is not necessary, however, to lose consciousness to have a concussion. If you do lose consciousness, you have to go to the ER right away. It's medically important that you do that. If you do not have a loss of consciousness and you have any of these symptoms, it's not necessary, but it's perfectly fine to go to the hospital, the ER, or your primary care physician if you have the time. It's extremely important that you get this dealt with because it is a brain injury, which can impact a lot of facets of your life. So there are also children-specific symptoms. Now, these symptoms may seem similar to what would be expected of the overall population, but they may manifest in a slightly different way. So, for example, there might be an increase in crying, which is more often in children. There might also be an increase in temper tantrums and maybe aggressive behavior and irritability. There might also be changes in eating habits following this concussion event, in which case maybe they might eat different things, or they might eat more or less. It's also possible that they act differently at school. Maybe they are more frustrated, or they have less desire to be social. It's also possible that, during sporting events, they might not act like themselves. They might not put in a full effort. And they might also have a really difficult time paying attention during school. So if you're having these sort of warning signs and you're a little bit concerned, there's a few different ways that you can be assessed for a concussion. One of the ways is if you have had previous baseline testing. Now, baseline testing is typically used with athletes, and it sometimes is required for participation. Baseline testing for concussions is a program that has a series of mini examinations that test learning and memory skills, your ability to pay attention, your problem solving, and it can be given after a suspected concussion. So your data that is given before maybe the start of a season or the start of a year is used as this baseline number of your brain is healthy right now. So when you think that you might have had a concussion, so when we can take that test again, we can compare the results, and you might see that maybe your memory had a decrease and maybe you weren't able to do some problem solving like you were before, which could indicate concussion. So the other one that you might have is more common. It's with no previous baseline testing, which is a concussion evaluation that is given possibly by your primary care physician, and it can determine which type of concussion you've had, depending on whether you've had a loss of consciousness or not. And eventually there can be progression after this. Maybe you were diagnosed with a concussion and it can lead to a recommendation that you have neuropsychological testing to test for different impairments in your brain function or your cognitive ability. So the ways that you think and can problem solve and can pay attention, like as with some of the impaired brain abilities that I described earlier. It can also lead to a physician evaluation, which would typically be involved in sports clearance. So if you have been diagnosed with a concussion and your primary care physician tells you a certain game plan of how you need to recover from this, this can lead to, after a certain amount of time, going back to a physician and being medically cleared to return to play. So you have been diagnosed with a concussion, and there are a few initial treatment options that you can have to sort of minimize any damage. So during the first 24 hours, it is very important. The number one thing is just to rest. Don't do anything. You need to avoid looking or doing anything that could stimulate your brain. That could include looking at your phone, which I already described earlier, could have other issues with light sensitivity. You want to avoid reading newspapers, books, street signs, anything that will make your brain have to cognitively think and maybe put pieces together. Now, after about 1 to 2 days, now is where you can start using pain relievers such as ibuprofen or naproxen sodium. It is important to not use these specific ones after 1 to 2 days because they can be more prone to bleeding, and bleeding can have difficulty when your brain's recovering. But if you are going to use one during the first day following a concussion, use Tylenol because it reduces your chance of bleeding. After these 1 to 2 days, you also can begin to have limited exercise and limited brain stimulation. And if any of the symptoms that you previously had come back, you need to immediately stop and start back at stage 1 because your brain needs to recover properly. So the week following a concussion is extremely important. Specifically, about 7 to 10 days are very important. During this period of time, your brain is undergoing a period of reduced activity. And with this comes an impairment in spatial learning and working memory. Spatial learning is sort of your brain being able to understand organization, location, and arrangement of different places and objects. So for example, if you had an impairment in spatial learning, you might have difficulty remembering how to go from your house to your friend's house, your house to the grocery store. Working memory, on the other hand, is this place in your brain where you take in information, but you haven't been able to store it yet. So it's still there, but it's not sort of in your long-term memory that you're going to remember for a long time. Impairments in this could be difficult if you were trying to write down someone's or remember someone's phone number. You might have to get it told to you a few times before you can actually remember it, because this impairment in working memory isn't going to let you store it for long enough to be able to actually remember it. It is important, though, that, as I explained earlier, you have to rest and you have to take care of yourself. This is because if you have a second concussion during the same 7 to 10 day time period, it can actually cause worse impairments in memory. In a nutshell, it essentially combines the effects of both concussions, which can lead to very negative cognitive and brain impairments. However, if you have a second concussion after this time period, now 7 to 10 days is not a very strict time period, but roughly after those 7 to 10 days, if you have another concussion, your brain does not treat it as a combination of two concussions, it treats it as a separate concussion. So your brain has healed itself during that time period, and it is now hurt again, so it can have time to heal a second time. Something that is possible but is not that common is post-concussion syndrome. Now, this is in about 1 in every 10 individuals that have a concussion the first time. And this is an extension of symptoms past what would be considered normal for people that have concussions, which, might be 2 to 3 weeks. They might have concussion symptoms at the latest. So if you have concussion symptoms from maybe 1 to 2 months following your initial concussion, it's possible you might have PCS. Some of these symptoms could include cognitive, so your difficulty paying attention and possibly remembering things. You might have difficulties falling asleep. You also might be more irritable or more prone to have anxious or depressive tendencies. And lastly, you might have those physical symptoms, such as headaches or light and noise sensitivity. So there are additional treatment options that you can have if these symptoms aren't going away. One of the big ones is cognitive behavioral therapy, or CBT. CBT, in a nutshell, teaches you that you might not be thinking about things in the correct way, and by changing your way of thinking, you might be able to change how you're feeling or maybe even how you're acting. So a big part of this is teaching people how to cope with their symptoms until they can go away. So it teaches people how people with concussions normally recover from this. You don't want to seem like your symptoms are unlike what other people have, and it might make you a little bit anxious or nervous. So by telling you how people normally recover, it might put you at a little bit at ease. It also helps you prevent attribution of normal occurrences to the concussion. So it's possible that you might not remember something, and if you've had a concussion, you might think that, oh, this is a result of the concussion, which is not a very healthy way of thinking. You can't necessarily determine that. So you want to make sure that different symptoms in your daily life that you're having are being attributed to the correct thing, which CBT is going to help you with if you've had a concussion. Another one that you can do is rehabilitation. There are a lot of different rehabilitation programs that you can have. If you have any issues with balance or dizziness, you could go to a physical therapist. If you have difficulties with your speech, maybe it was incoherent, you might go to a speech therapist. it's possible that you might have visual difficulties and other memory difficulties. There's therapists for this as well. In general, all of the symptoms that you'll have for a concussion, if they linger, can be helped out by a therapist in some form. So I want to thank you for listening to this presentation. And there were a few questions that I was asked privately by another viewer. So one of those was, how do you know if your symptoms are gone from a concussion? Typically, you're not going to know specifically if your symptoms are 100% gone. Normally, they'll probably just fade away. There may be periods of hypersensitivity that you'll have. If you are informed about concussions and what those symptoms are, you might think that you have them longer than you actually do, which can make you feel actually that you'll have them. But over time, that will sort of go away and you'll be able to resume your normal life. The second question was how to get to support groups and rehabilitation programs. Your primary care physician is going to probably be your biggest expert on this. They will have experienced enough concussion patients in their time that they'll have recommendations for the different people that you need to see or the different groups that can help you cope with your concussion symptoms. So again, I thank you for listening to this presentation on concussions. I hope that it will help you or maybe your child either prepare, become more knowledgeable, or help with an actual possible concussive incident. And again, I thank you for your time.